Sickle cell anemia by me, Evelyn Wham. So, about the disease. Sickle cell anemia is also known as sickle cell disease or SCD for short. It's a red blood cell disorder that affects the hemoglobin in the body, and this causes a cell to form a sickle shape or like a crescent, kind of like the moon. Hemoglobin is a protein in red blood cells that carries oxygen throughout the body. So, when was it discovered? It was discovered in 1910 officially, and throughout the 1900s, there were more discoveries about the disease as the years went by. Who discovered it? Dr. James B. Henrick and Dr. Ernest Irons discovered it together. Dr. Ernest Irons was the apprentice of Henrick, and Irons officially, technically discovered the disease by discovering the sickle shape first. So, symptoms and statistics. Symptoms. So there's anemia or like lack of blood, and there's pain, swelling of hands and feet, infection, vision problems, stroke signs, delayed puberty, and fatigue. This all happens because since the hemoglobin's affected, there's a delay in oxygen being moved throughout the whole body because the sickle shape makes it really hard to move throughout the blood vessels. Body systems that are affected are the immune system, nervous system, and organ system. This is a recessive and autosomal disease, and the prognosis / life expectancy is 48 years old in females and 42 years old in males. The prognosis rate for surviving up to adulthood is 94% in the U.S. And of course, all of this grows and the increases as medicine improves and stuff like that. So the group that's most affected are African Americans, and it doesn't affect specifically either male or females because it is autosomal, so meaning it's not sex linked, meaning it doesn't affect just one specific sex mostly. And there is no specific age group affected because you get this inherited from like when you're young to the rest of your life unless you get it treated. And most people are diagnosed in their early years of life, like 1 to 2 years old or a couple years old. Genetic information. So, what protein, genes, and chromosomes are affected? Chromosome 11 is affected, and overall, the hemoglobin protein is affected. Hemoglobin is made of 4 subunits of proteins, 2 alpha globin and 2 beta globin. In sickle cell disease, the beta globin is affected because the HHB gene is affected. And what the HHB gene does is it provides instructions to make beta globin. So how do people get it? It's inherited from your parents. That's how people get it. And you could be a carrier. You could have the trait but not have it. But it's honestly by chance inheriting this because you need two bad genes, one from each parent. So what the mutation causes. So the mutation in the HHB gene makes abnormal beta globin. This replaces the normal ones, the normal beta globin in the hemoglobin, and this causes the hemoglobin molecules to stick together to make rod-like structures, and this makes the red blood cell really stiff and it collapses it on itself, making the sickle shape. Diagnosis and treatments. So for diagnosis, we have blood tests, and they're the most commonly used to diagnose sickle cell anemia. And basically, for a blood test, you take the blood of the patient and you check for abnormal hemoglobins for if you want to check for sickle cell anemia. And then they'll see how much abnormal hemoglobin there is to normal hemoglobin, and they'll diagnose whether you have sickle cell disease or not. Also, they can look at the shape of the red blood cell. Blood tests are usually taken now for all newborns to catch the disease earlier, to start treatment earlier. And also, blood tests can be taken before having a child to see the likeliness of the child having sickle cell disease. Then there's amniocentesis, which is basically where they take the amnio fluid from the pregnancy sac and they check for SCD in the unborn baby. Then there's a new diagnosis called pre-implantation genetics. It's basically where they test the embryo for sickle cell anemia, and if they find it, they replace it with a healthier embryo out of the sac. So the two actual treatments that are helpful, really helpful, are bone marrow transplant and blood transfusions. In bone marrow transplants, they're usually only used for severe cases, and it's basically where they extract the bone marrow from another patient, and then they put it into the sick patient so that it fixes the production of hemoglobin and red blood cells for healthier ones. But it's also really hard to find a donor with a really good match to your bone marrow. Most of the time they use siblings, but even so, it's still really hard. For blood transfusions, so you draw blood out of a healthy patient, and then you pick out the red blood cells, and then you put them into the sick patient, and this increases the production of normal hemoglobin. For medication, it's usually only aimed at reducing the pain of sickle cell anemia. And some examples of this pain relieving medication is hydroxyurea, which is also the most commonly used for sickle cell anemia. It's also used in cancer to reduce the pain. Then there's L-glutamate oral powder, voxelotor, and cruzanlizumab. And obviously there's other pain relieving medications prescribed by doctors like Advil and stuff like that. And then there are also preventative options you can take, taking vaccines so that you can prevent infections or certain symptoms you may get from having sickle cell anemia. And not only that, but most of the time when a child is diagnosed with sickle cell disease, they are given immediately a gene counselor so that they can help the patient. So future medicine/treatments, the only one I found was gene therapy. And what they plan to do with gene therapy is they're experimenting with the sickle cells and correcting them to make healthier cells. And they're trying to put the healthy cells back into the bone marrow to produce more hemoglobin. Also, they plan on trying to find a way to fix the HHB gene so that it will produce normal beta globin so that everything can be avoided. So what I learned was the main cause of sickle cell anemia is the defect in the HHB gene. And sickle cell anemia is a recessive and autosomal disease, and it was discovered by Dr. James B. Henrick and Dr. Ernest Irons, but the shape was founded by Dr. Ernest Irons. And African Americans are the most affected by this disease. Not only that, but blood tests are usually the most common test used to diagnose sickle cell disease. And here are my works cited. Thank you for